Welcome to Portal to Health, using the patient portal to support chronic conditions, Microlearning series, brought to you by the California Telehealth Resource Center. This kicks off Session 6, Portal Features to Support Chronic Care Management. Before we begin, we want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative support services with providers and patients located across all 58 California counties and beyond. As part of a collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017 and together reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations and serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. HCCNs are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology, very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports over 100 participating health centers using a variety of electronic health records and serving over 4 million patients and is funded by HRSA. We welcome you to check out the OCHIN HCCN webpage to learn more.
And who are we? We are your speakers for today. My name is Lourdes or Lulu Gonzalez, and I'm a learning content designer. And Angie Brown, my wonderful colleague, is also a learning content designer. And before we jump in, here's a list of all the microlearnings in this series. Each session is designed to deliver quick learnings on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. With that, welcome to Microlearning 6, Portal Features to Support Chronic Condition Management. In this session, we will cover typical features and functions of the portal and advanced features that are used strategically.
Okay, so let's begin by looking at some high-level ways use of the portal advances chronic condition management. So one, the portal's flexibility and versatility enables patients to have a convenient way to connect to their providers, records, and care reminders. And two, portals can increase clinic bandwidth by streamlining or automating certain processes, such as booking appointments or making payments. Additionally, when patient portals are used in conjunction with triage pools, routine or non-clinical messages can be managed by clinical support staff working at the top of their license rather than the physician. 3, the portal offers options for self-management and patient education, maximizing resources that support quality care. 4, patient portals can serve as the anchor for telehealth and virtual care services by offering integrated video visits and remote patient monitoring features. And 5, finally, patient engagement is a central focus of value-based care models. Patient portals support the active relationship between an engaged patient, provider, and care team, which is a pillar of VBC. So with that, we'll dive into the features that can help support chronic condition management through the portal. So looking first to the core features that provide great benefit to patients with chronic conditions, these classic portal functions are available through most platforms. This includes medical information access, which is available 24/7, lab and imaging results for patient review, ability to review medications and request prescription refills, secure care team messaging, ability to update personal information and insurance, and scheduling or requesting appointments.
Yes, but looking beyond the classics, we can think of certain sets of features as their own powerful drivers of portal use and condition management. Virtual care continues to gain momentum because it limits the spread of infectious disease, and it also reduces barriers to in-person care. Through the portal, it is possible to assemble a virtual care hub by using the individual and group telehealth visit options, and this can include peer support sessions for specific conditions. We also have symptom checkers for self-triage ahead of contacting the clinic, a live chat with staff or automated bot that can help direct patients, a home for patient-centered health data, patient-generated health data, remote patient monitoring, and patient-reported outcomes, synchronization with large platform health apps like Apple and Google, and the ability to access the portal through various devices such as a desktop computer, tablets, and mobile phones. And this hub can drive engagement, especially for patients who are interested and comfortable using virtual care solutions. Communication is, of course, central to the patient portal's purpose. Patients appreciate the communication tools that are offered through the portal, so we can think of this as a communication suite. And that includes the ability to view visit summaries, care plans, and provider notes after a visit can really make or break adherence to medical advice. These materials give patients the chance to digest information, seek help with understanding, and developing their own strategies to meet their goals. Automated reminders have been proven to decrease no-show rates, decrease administrative burden, and improve patient satisfaction. This doesn't have to be done through the portal, but when reminders are connected to the ability to confirm details, cancel, or request new times through the portal, the benefit can really be maximized. Along the same lines, automated health reminders promote preventative care, support engagement, and can reduce downstream costs to patients and organizations alike. Patients can also contact their care team to keep in touch about follow-up, concerns, questions, or non-emergent needs. Some messages can be directed to other roles such as billing and scheduling as well.
So, though indirectly related to chronic condition management, the portal also gives patients financial insight and control, allowing them to pay bills online, view balances and payment histories, and plan for costs through good faith estimate calculators. Patients enjoy the convenience and security of online bill pay, as well as the immediacy of posting and reduced paperwork. One less stress. For the clinic, this can also be crucial to reducing days in AR or accounts receivable. Studies show that patients that can pay their bills online through the portal are more apt to pay and pay off balances more quickly. So efficiency benefits patients as well as staff. The portal's integration with the EHR ensures that information goes into the portal gets to the provider. This supports communication, engagement, and coordination, and contributes to better health outcomes. Staff are also able to analyze portal data through dashboards and other data visualization tools, enabling them to adjust strategies and meet current needs. And then patients can efficiently share documents through the portal by uploading forms, images, insurance cards, and other information. This can improve workflows, reduce burden, and provide timely exchange of necessary information.
Yes, but as we all know, technology comes with security risk. Thankfully, the patient portal can be a fairly safe space for patients and providers when HIPAA standards and cyber hygiene best practices are followed, like password protection, encrypted messaging, using a zero trust framework, opt-in consent, and appropriate staff training and oversight. Portal enrollment includes secure steps for sign-up, which can be further supported through in-person or written guidance. And patient-facing security features like multi-factor authentication can sometimes cause frustration, but may provide added comfort for those extra concerned about account security. While another indirect benefit, the security can encourage patients to enroll in and use the portal. And one of our personal favorites, the portal can be also thought of as a resource library for patients. It's the one place to find educational materials tailored to their needs and conditions, tools and tutorials for portal features, telehealth, remote patient monitoring, or other offerings, and the patient can also access insider news about the clinic, including staff changes or events. And having a streamlined resource for those various types of information supports engagement, self-directed learning, and empowerment.
Okay, lastly, this one is just for fun, but some portals do allow patients to personalize their interface, making it feel more reflective of themselves and more likely to return. This could include choosing colors, profile photos, and application preferences, like language settings, and then filtering non-clinical information feeds according to interest. So that brings us to the end of Microlearning 6. Some of our key takeaways are that the patients that use the portal tend to stay with their clinic longer than those that don't. Patient portal users tend to better adhere to medical advice and care plans, which can be critical for self-management of chronic conditions. Combining basic and advanced features to create drivers for engagement, self-management, and improve outcomes have really been successful. And embrace features and functionalities that patients and providers like. Consider enabling features that make the most sense for your patient population and resources.
Yes, and what's next? Our final microlearning, Microlearning 7, Increasing Portal Engagement. Join us to discover insights and ideas on how to boost patient engagement with the portal and sustain your momentum. And thank you to HRSA for supporting this content.
And for ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, on-demand resources, and more, or reach out directly to caltrc@ocean.org. Finally, don't forget to sign up for CTRC's newsletter to be informed of all the most recent events and news. And thank you so much for joining us. We hope to see you in session 7.